Hello everyone, my name is Morgan Redmond. I chose to do my body systems presentation on the metabolic system. The metabolic system includes a lot of different organs. We have the liver, the pancreas, the gut, the brain. Your thyroid gland plays a really big role in the metabolic system as well. And so today I hope that I can teach you a little bit about how the metabolic system changes with age and the different processes that go on as a person gets older. So what is the metabolic system? For short, a lot of people like to simplify it in saying that the metabolic system is how things are broken down for energy in the body. Now that is totally correct, but there's a lot more that goes into the metabolic system. For example, the resting metabolic rate. The resting metabolic rate, or RMR, is the rate at which your body burns energy when it is at complete rest. So when you first wake up in the morning is often the best time to calculate your resting metabolic rate. Before you get up, walk down the hall, brush your teeth, anything that exerts energy. You can calculate your resting metabolic rate to see how many calories your body needs to perform basic functions like breathing and circulation and any everyday tasks. But you may need more calories depending on how many calories you exert when you do exercise or walk or anything like that. So the first major change in the metabolic system with age is insulin resistance. We've heard a lot about this when in the hospital talking about diabetes type 2. As you can see in the picture at the bottom, this kind of explains a flow of insulin resistance and how it comes about. So when you eat a carb, your body uses it for energy, and in order to counteract the high blood sugar that you receive from eating carbs, your pancreas makes insulin to balance that back out and bring your blood sugar back down. Now, when you eat a lot of carbs or a lot of sugars and your body is forced to use a lot of insulin to counteract that, your cells slowly begin to resist the insulin. And then your sugars are stored as fat, and fat in excess amounts tends to make you feel tired and very, very hungry, creating the chain again of eating more and more carbs. So we all know that as we get older, our body composition changes. We tend to gain weight, our waistlines get a little bit bigger, and it's not necessarily something that we all like. But we all know that it's happening, and it's important to understand why that happens. So the reason that that happens goes back to the previous slide where I talked about your resting metabolic rate. That is the number of calories that you burn daily to fuel your body functions, your heartbeat, your brain, digestion, all of these things. The more muscles you have, the more calories you burn. So, with that being said, the decline in muscle mass that begins in your 20s, coupled with the decrease in your activity level, means that you need fewer calories in your 60s than you did in your teens. For example, a 180-pound male's BMR accounts for about 1,930 calories in a day between the ages of 18 and 30. But after he ages to 60 years old, his body needs 350 fewer calories to maintain his weight and good health. So even if he's still eating like he did as a teenager, that would explain why he is putting on more pounds, because the amount of calories he burns in a day is a lot less. And the last change in the metabolic system is a decline in growth hormone. This would explain why a lot of the elderly population tends to be much smaller and petite in stature. Okay, so this slide has a few more changes in the metabolic system. A lot of this is a repeat of what we've already heard, but it's still very important to reiterate. There's a decrease in the ability to adapt to stress. Like I said before, there's a decrease in the metabolic rate. There's a decrease in the thyroid gland related to the calcium absorption and energy level, which I will touch on a little bit in a moment. And then there's a decrease in the essential vitamins and minerals, which means that it's super important for these elderly people to be taking supplements to counteract that decrease in the body producing its own vitamins and minerals. So for you visual learners, I just wanted to give you a little bit of a explanation that you can see with your own eyes. So starting at food intake, we take in all of the food, then the food is broken down within our body, and our body uses that broken down food as energy. So energy is created, and then the body is repaired and uses that energy to become active. So this is where the activity energy goes in, and when you exert all of this energy through activity, it makes your body more hungry so that it can get more sugars, more carbs to create that energy to start the cycle all over again. Okay, so because your body has a decreased adaptability to stress, it is very important that we maintain a routine to reduce the stress. So whether that include meditation, yoga, deep breathing, anything that can reduce stress on the body. If you know that something in particular causes you a lot of stress, try to avoid these things as much as possible. Second is temperature adaptation. Have you ever noticed that your grandmothers tend to be super, super cold when the room feels perfectly normal? This is because the elderly population has a lot lower tolerance to heat and to cold. Third, you may need calcium or vitamin D supplements. A lot of these elderly people don't spend as much time outdoors, and so vitamin D supplements are a much easier way to get that proper nutrition through there. And then calcium is very important for their bone strength and health, and this is why a lot of them should be drinking more milk and more cheese and all these things that have a lot of calcium in them to build up their bones. And lastly, it is so important for these elderly people to understand the importance of exercise and wellness. Exercise and wellness will prolong their life so much, and it is super important that we teach them these things, all of the things that are listed above, to help them to live the best life possible and to feel a lot better as they progress. There are a lot of different types of thyroid disease. As a person gets older, the prevalence of this increases significantly. The two most common are hypothyroidism and hyperthyroidism. Hypothyroidism is a disturbance in the older adult's thyroid gland. It's the failure to produce the adequate amount of hormone thyroxine. An older adult may complain of heart palpitations, slowed thinking, gait disturbances, fatigue, weakness, or cold intolerances if they have hypothyroidism. Some of the biggest symptoms that you will see with hypothyroidism in older adults is fatigue, weakness, depression, dry skin, weight gain, cold intolerance, and muscle cramps. So because hypothyroidism is the lack of the hormone thyroxine, it is an easy fix. The patients will just take a oral version of the thyroxine called levothyroxine. So next we have hyperthyroidism. This is an excessive presence of the hormone thyroxine in the body. While it does not occur often, women are 2 to 10 times more likely to develop it than men. Compared to hypothyroidism, the onset of hyperthyroidism may be quite sudden. The signs and symptoms in the older adult include unexplained atrial fibrillation, heart failure, constipation, anorexia, muscle weakness, and other vague complaints. Symptoms of heart failure or angina may cloud the clinical presentation and prevent the correct diagnosis. On examination, the people are most likely to have tachycardia, tremors, and weight loss. Everything in hyperthyroidism tends to speed up, and everything in hypothyroidism tends to slow down. So there are a few complications of thyroid disease. Both occur as a result of treatment. And so one of the biggest things is myxedema coma. This is a serious complication of untreated hypothyroidism. If the disease is not detected until quite advanced, then unfortunately death is a very common occurrence. So we've all learned a lot about diabetes, but to reiterate, diabetes mellitus is a syndrome of disorders of glucose metabolism resulting in hyperglycemia or high blood sugar. The two main types of diabetes are type 1 and type 2. Either the body does not make enough insulin to move glucose into the cells, which is type 1, or it does not make enough insulin to keep up with the needs of the body, type 2, as in the case with obesity. In other words, insulin is available, but the cells, especially the muscles, liver, and fat, are not able to use it. This is referred to as insulin-resistant diabetes. So we all know the risk factors for diabetes right now, but a few of them could be that the person is very overweight, that they do not exercise regularly, and that they ingest a lot of fatty foods, as you see in the picture below. The classic signs and symptoms of diabetes include thirst and excessive urinating as the body tries to reduce the relative concentration of glucose in the blood. Yet, hyperglycemia appears to be well tolerated later in life, and there may be no early warning symptoms until the person is found in a life-threatening coma. A lot of the nursing implications for diabetes include education. So one of the things that you can teach about is eating a healthy diet. This means lower carbohydrates and lower sodium. The patients need to get regular exercise. They say 3 to 5 30-minute workouts a week is really, really good and will minimize a lot of the cardiovascular risks in a person with diabetes. We also need them to stop smoking, maintain a hemoglobin A1C of less than 7% if possible, and attain all the normal lipid levels. So upon assessment, some of the really important things that as a nurse you need to make sure that you are assessing is weight changes. So we can do this by weighing the patient every day at the same time in the same clothing and making sure that the patient's void beforehand. Another thing is you need to question your patients about the presence of polydipsia, polyphagia, and polyuria. So these three things are the classic cardinal symptoms of diabetes, and if we catch these early, then maybe we can eliminate the problems that may occur later. So another thing we need to watch out for with the older population is the dryness of skin and hair. A lot of these patients aren't necessarily taking in as much water as they should be, or their water in their body is being used for other things because the water is trying to dilute the blood if they have glucose imbalances and many other things. So just feeling of the skin and the hair for the presence of any dryness is super, super important to understand their hydration level. And then last, to understand the presence of hyper or hypothyroidism, we should really understand and listen for a slowed speech or a rapid speech. This a lot of time is present with different thyroid diseases. Next, we need to assess their ability to differentiate between hot and cold and understand that sometimes they are intolerant to these heat changes. And then if that is the case, then we need to make changes and make sure that we don't overexpose them to hot water and create a burn or vice versa. Next, we need to monitor their rate of growth. So are they getting shorter? Are they stooping more? Anything like that. So getting an accurate height every single time that they come into the office is very, very important. Last, we need to notice the changes in glove, shoe, or ring sizes. So if a patient has an aldosterone imbalance, then they could have Cushing's or Addison's disease, meaning that they retain too much water or that they excrete too much water. So by seeing if their feet are swollen in their shoes and they need to wear a bigger size, or their rings are a little bit too tight and their fingers look puffy, this could be a good indicator that there's something going on with their aldosterone levels. So the first thing that we talked about in this presentation is what is metabolism. So this is how energy is used in the body. Then we talked about a lot of the changes in the metabolic system, such as insulin resistance, an increase in body fat and a decrease in body muscle tone. And then we talked about the education that we must provide as a nurse, whether this be diet changes because the person may not um, break down as many calories in a day in their body, and so they may need to reduce the amount of calories that they're ingesting in order to maintain their current weight, or if they need to be more aware of the heat and cold intolerances, or even if they just need to start taking a vitamin C or vitamin D supplement because their body doesn't produce these things anymore. Education is so important in what we do as a nurse. And then we talked about the pathophysiology, so the differences between hypothyroidism, hyperthyroidism, and diabetes, which all of these things are very, very common in the elderly population. So it's super important that we understand a good amount of that information. And then we talked about the assessment of patients with metabolic changes. So this means that we take their weight more frequently, their height more frequently, and assess the functions of their thyroid gland or any other glands in their body, such as the pancreas, that really have to do with the metabolic system. Lastly, I just want to thank you guys for listening to my PowerPoint, and I hope that you understand a little bit more the changes that go on in the metabolic system as a person ages. Thank you, and have a good day.